Hi, I'm Dr. Jen Remnes.
And I'm Dr. Jess Trice, and this is Real Talk with Vet Candy.
Real talk means real conversations with your BFF.
This program is brought to you by KBrovet. Learn more at kbrovet.com.
And this episode is about doing it all.
How the heck does she do it? There are only 24 hours in a day and not 1 second more. How can you make the most of it and keep your life fully balanced? Let's conquer everyday challenges from career, money, dating, relationships. Get it done with us.
Yeah, I mean, we do wear a lot of hats, don't we?
We're Jill of all trades, that's for sure.
We really are. I mean, honestly, let's see. Let's name some of the stuff that we do. We are entrepreneurs.
We're veterinarians.
We're veterinarians.
We started there.
We are daughters. We are fur mamas to dogs and cats.
Wives, partners.
Soon mama to be. I mean, we have all of these things in our plate. However, where do we find time for ourselves for, stress relief, self-care?
The best answer, Dr. Jess, is I'm still figuring it out.
I think there's no real answer to it because every person is different. Every individual has their own way of, resolving their problems, helping themselves to making sure that they do get that self-care.
Absolutely.
And it's different for everyone.
So it's going to be a different path for everybody, that's for sure.
Well, let me ask you this, Dr. Jen. What is your pathway to the success?
Like I said, we're still figuring that out day by day. But I think just prioritizing the important people in your life and the important aspects of your purpose, just really prioritizing and devoting time to where you need to be. Yeah. I mean, loved ones, that's huge.
Yes, it is. I think for me, it really starts with the mental balance. If I am not mentally balanced, starting off with me in the mornings, I just have to make sure I have that meditation and prayer, doing that workout, just really getting myself in check. Then I feel like I'm okay for the rest of the day. Because you have to be that way, right? Because if you're not ready in those ways, how are you going to be ready and prepared for your patients or for your team and things like that? So,
can't pour from an empty cup, that's for sure.
Yeah.
We emphasize self-care so much too. So that's really hitting all of the facets that make you who you are and make you happy.
Yeah. Well, I think part of our vision too, as you see behind us, it's treating yourself. So we take that a step further. Besides, obviously, we want our pet owners to treat their pets. We have our pet treats and everything like that, and treating the humans themselves with some drinks. But it's also taking that step further and treating them as well, which is why we do offer this for them. We do offer the neck warmers. We do offer all these services for them because we want to make sure that they are stress-free when they come in here as well. So
stress and anxiety, huge, not just in the veterinary industry, but in society. I mean, it's so important to take care of your mind, your body, your soul, all of it.
Yeah, and I think it goes back to that whole not one more vet that we see that's going on. I mean, that came up because there's been so many suicidals in the veterinary industry. I mean, let alone
our profession ranks number one, which is
really
super sad.
Yeah,
super sad.
That's why we really want to stress with, taking care of yourself. Even though we do have all these roles, it's prioritizing, decompressing once you're done with work, come home and get that lavender bath.
And it's okay to say no, too.
Hit the pause button.
Yeah, when you need that self-care time, when you need time to just process your thoughts and keep to yourself, that's okay. Yeah. That's okay.
Yeah. I'm not going to lie. Okay, so being pregnant here, it's been a battle. Honestly, though, it's been a very easy pregnancy.
You're a trooper.
But when you have a great support staff and great friends that support you, I mean, Dr. Remnes has been amazing. The team, the management, everyone has been so wonderful. And, but it's okay to vent. There's a lot of women out there in the career where they're leaders, they're doing their careers, they're working as doctors, they're doing all this stuff, yet they're still doing that when they go home to their families and doing all this. I mean, that's a lot on your plate. And I want to tell you that it's okay to take a moment if you need to vent. You are allowed to vent. We have to do that, because if you don't, it's going to build up inside you.
You'll internalize everything, and then it'll just be a combustion.
That's not good.
No, it's not.
It's not good. It's normal. It's normal. So go ahead and do that. And once you vent and you take care of yourself, then go back to, your normal life and going back to your family and things like that. So
I know personally I have to take a step away. If I'm getting overwhelmed or flustered, that absolutely carries over into my work. So for my patient safety too, I find it's best to take a step away, scream it out if I need to, shake somebody. No, I'm just kidding. And come back when you're ready to go. It's okay for those pauses, mentally and literally.
Literally, yeah, hit that pause button.
Yeah.
Don't be afraid to hit it. And don't be afraid, the other thing too, in your work field, to go to your boss or go to whoever your leader is and say, I need to have a moment, a break. Even if it's a 5-minute break, even if you need a longer lunch period, don't be afraid to ask. That is more important. You are more important. You are valuable.
Your
So
mental
keep
health
that.
is important too.
Yes.
And we talked a little bit about it on our previous episode, but health and wellness are crucial. Making sure you're getting appropriate sleep, making sure you're eating the right foods. All of this really encompasses the whole body as one unit.
Yeah, it really, really does.
I don't know about you, Dr. Jess, but I need to tackle one thing at a time. If I try to take on too many tasks at one time, I'm spreading myself too thin. I'm not actually fulfilling what I need to fulfill, and I'm not operating with intention.
That's a great point, Dr. John, because I feel myself sometimes, we get all these text messages from our work, and we're in the middle of doing something, and you're trying to respond
The
back.
bank,
and call
the construction team, everywhere.
everything. Hey, we have a client here, a client would like this. And, there's days that, we get these messages on our off days, and it's fine. We definitely want to be able to do that. But to your point, you tend to spread yourself thin. And when you feel that way, you're not giving your full potential of what could be happening or what you could
Not
do for that person.
100% of you.
Yeah, and that's really important. That's key. So I know one thing that really can help us is delegating. We have a team here. We were just talking in one of our other episodes. We have 3 fantastic managers.
We do.
And they have been wonderful. And you really cannot get through a business without having that support system. And I really feel like we have that. And that really helps, create that successful business when you do have that support staff, when you do trust your team to delegate
I was
things.
just about to bring that up. You
Yes.
need to establish that trust factor first. Learn how one another works and operates, so you can work effectively and efficiently together. Teamwork makes the dream work.
Oh, it certainly does. Teamwork makes a dream work. It all started here. And then the other thing too, with the whole how do we do it? From the beginning when we're starting this whole process, can you imagine, just looking back,
Everything we dealt with, this was a 3-year process.
Started during the pandemic. Who would have guessed? Who would have in their right mind say, hey, let's start a business during this pandemic?
We signed up for it.
We sure did.
Yeah,
thank God we didn't quit. I'm sorry, but thank God we didn't quit. But it's been
a roller coaster.
Journey.
We've learned a lot. We've grown a lot.
We have.
There are some things we absolutely would have done differently in hindsight, but that brought us here and where we are today.
Yeah, and I'm so thankful because what we've been through and what we've gone through, we've certainly learned. And so when more of boutiques open up, we'll know what to do and what not to do.
Exactly. What else?
I think going along the lines of how do we do it all? Like, how does she do it all? How do we do it all, especially in our veterinary community, our veterinary field, because it's such a high stress, demanding career.
Absolutely.
And we had one of our episodes that we talked about dream jobs. Like, I really truly believe all of us veterinarians that are veterinarians that actually made it, we are happy with our dream job. But there's also that piece of how do you balance it all?
All the stress,
Yeah.
the daily stressors, the burnout, the compassion fatigue,
Yes.
all of that.
And I think we have to look back into our why. Simon Sinek actually brought this up in a TED Talk about knowing your why. And if you know your why, that can really help motivate you to doing your dream job.
You can live with intention.
Balancing it, yes. So if you can wake up every morning and say, you know what, I know my why, I know my purpose, follow your passion, and then do take care of yourself.
And don't give yourself another option, right?
No,
That's
there are no
always been
options.
my quick answer to how do you do it all?
Yeah.
I know my route. I know where I want to be at the end of the day. Don't give yourself another option. Don't pile on excuses of, it's too much money, it takes too much time, I'm too old. I think set your mind right, have that intention, and get after it.
And speaking of that too, when the negativity, when we're going through this process, I mean, do you remember hearing, oh, you guys are crazy, this is far-fetched, no one's going to take you seriously. I mean, we've heard everything. And if we would have taken those comments to heart, we would not have had a fatigue here.
Absolutely.
I remember there's times when I've actually lost some friends, and whatever the opinions that were made, and certain family members. And when you hear that negativity, like, these are people that were there for you when bad times, but when you have true friends, they're supposed to be there for you in good times as well.
Through the thick of it all.
Everything. And so I think this was a real trial that we both have gone through.
Absolutely.
And I think, at that point, you really have to focus on your supporting system.
I was just about to say that.
Yeah.
Find that person, that key person or that key team, it can be multiple, that are going to help you get to the finish line. I know personally, I wouldn't have gotten through this venture without her. We split all the responsibilities. It was 50-50. If I had an off day, she had a good day to balance me out, and we reached the end that way. So.
We really are truly sisters. We're sisters from another mother. But really, we really feed off of each other. And I just remember there's just some days where I was very upset, emotional, hurt. I mean, this is real, guys. I mean, no matter if you're trying to open up a business or you're starting a new career, or
you just graduated too, or taking an ASLE, anything.
It's hard.
There's daily stressors. You just can't avoid them.
Vent all you have to vent, but at the same time, having that strong support group, whoever that may be, like, go to them and do that, because that will help you be a better person, help you feel much better, and be able to do what your dream job is.
Self-care, baby. That's where it all is. It really is the foundation to everything that this career has to offer. If you're pouring from an empty cup, you're not going to get anywhere with doing that. You're not giving your all to your patients, to your clients, to your colleagues, anybody. No. So what good does that do? So self-care for us, what does that mean? I mean, I definitely like to work out all of my end of day stress at the gym. I know you're more of a morning person.
Definitely morning.
Where I'm more of the night owl, but finding that time to alleviate the stress, get rid of all of the adrenaline, get it pumping.
Yeah. And I think for me, after work, I just decompress. I turn off the phone. I don't really talk to anybody, and just kind of gather myself. But yeah, in the morning, my workouts is my caffeine. So that really helps me a lot.
Yoga, anybody?
Bikram yoga.
Bikram yoga. It's a good way, just sweating it out. We love doing that. That would be more of your physical aspect. And I'd say also, spiritually as well. Huge prayer, meditation, whatever you feel. Journaling can be really, really great to just get your mind ready and spiritually ready. Absolutely. And guys, keep in mind, it's so important to schedule you time. Yeah. Mark that in your calendar, put in your iPhone notes, whatever is going to be the easiest way. I know on my days off, I have to actually, sometimes it's not really a day off because I'm piling up my self-care appointments, but it's so important that you schedule that away from the job. Yeah. And there can be many types of calendars. You have your work calendar, you have your family calendar, you have your me time calendar. I mean, but just make sure that you prioritize and you put that together, because if you don't do it, it ain't happening. Absolutely. So devote that time and respect it. Yes. And now let's hear from an expert.
Hello, I'm Dr. Jemiah Tracy, a board-certified veterinary neurologist, and today I want to tell you 3 key insights about KBROVET CA1. In the dynamic field of veterinary medicine, staying informed about innovative treatments is paramount. KBROVET CA1 is a promising solution for managing seizures in dogs with idiopathic epilepsy. Here are 3 essential aspects every veterinarian should know about this conditionally approved medication. KBROVET CA1's efficacy lies in its scientific foundation. Potassium bromide, the primary component, traverses nerve channels, creating a negative charge. This negative charge plays a pivotal role in reducing the likelihood of a seizure signal being transmitted to the next nerve. Understanding this mechanism is crucial for veterinarians, providing insights into how K-Bro-Vet CA1 delivers targeted and comprehensive seizure control. Bromide shows excellent gastrointestinal absorption, with peak levels around 1.5 hours post-administration. It undergoes no hepatic metabolism, making it suitable for dogs with liver disease. Administered once daily in a palatable, chewable French vanilla flavor tablet, K-Bro-Vet simplifies the treatment regimen. Another way K-Bro-Vet CA1 enhances compliance is that if a dose is missed, drug concentration fluctuation is unlikely to occur because of the 21-day half-life, which minimizes the risk of a seizure and also gives the pet owner peace of mind. Veterinarians should refer to the prescribing information for a comprehensive understanding of adverse events, warnings, and precautions. Veterinarians can seamlessly integrate K-Bro-Vet CA1 into their practices, providing optimal care for dogs with idiopathic epilepsy. So that does it for today's insights on K-Bro-Vet CA1.
Thanks so much for watching this episode of Real Talk. If you like this one, please drop a comment below or share with a friend.
And let us know what you want to talk about. Until next time.
Bye, guys.
Bye.